As a part of Our Future of Science, we, the Wonderwall teams, are presenting the importance of healthcare transparency. Have you ever found yourself in a situation where seeking help came with a price tag you couldn't afford? Imagine this scenario. You're a single mother working tirelessly in the healthcare sector. Your days are long and your workload immense, but one day the stress becomes too much and you collapse. Now ask yourself, what would you do? Would you seek medical assistance knowing that it would cost you dearly, or would you brush it off, hoping the problem would resolve itself? For Wanda, this wasn't just a hypothetical question, it was her reality. Overwhelmed and overworked, she refused medical attention multiple times, dismissing her condition as simply stress. But when she finally relented and sought help, she was met with a different kind of stress, a bill for $8,000, a price she simply couldn't afford. Desperate for assistance, Wanda pleaded with financial administrators, only to be told she made too much to qualify for help. Now burdened by medical debt, she fights to provide for her family. Wanda's story is not just her own, it's a reflection of a broken system where healthcare comes at a cost many cannot bear.
Like Wanda's story, according to a 2022 KFF analysis on medical debt, 1 in 10 adults nationwide own at least $250 in medical debt. That's 23 million people with medical debt, totaling to hundreds of billions of dollars in debt.
According to a KFF health policy, we found that underserved communities face higher healthcare costs. Three main factors contribute to this are lack of access and infrastructure, poor living conditions, and insurance and health disparities. These factors lead to delayed care, longer wait times, and higher stress. The lack of resources also limits health literacy. If a quality education is hard to access, understanding healthcare is even harder.
Increased transparency can affect better medication. Increased transparency can affect better medication decisions, medication alternatives such as natural remedies, over-the-counters, and more. This can help low-income people with cardiovascular issues treat their issues while still maintaining money.
Along with this cost transparency, people will understand insurance better, leading to more use of it, which is helpful for our target audience. There is no exact determined health outcomes, but it seems transparency still has helped many people. So Turquoise is a good tool that can help make this impact if more people knew about it.
Turquoise Health aims to boost healthcare transparency and literacy, particularly among vulnerable communities. We advocate exploring additional resources like $4, a nonprofit that provides charity care to patients. Another notable nonprofit, Ellie's Army, provides financial aid to children facing life-threatening illnesses. Eligible patients should also consider reaching out to Patients' Right Advocate, which works to lower healthcare costs through grassroots and advocacy. Lastly, don't be afraid to communicate with your providers and request discounts, especially in long-standing doctor relationships.
Now, if you're confused about Turquoise, just search it up. Here's an example of what it looks like.
By increasing healthcare literacy, we hope to empower individuals among vulnerable communities, thereby enhancing the quality of their lives. Thank you for listening, and all the links that we listed will be in the description box below.